It's very exciting for me to be in Croatia again. I was here for the first time last year, and I was absolutely enchanted with Croatia, and I'm glad I was asked back to talk about healing dentistry, and to be here is a perfect paradise. So I hope and it's the end of the day, so I'm going to try to give you a lot of my energy and my enthusiasm for this incredible technology, the idea of healing dentistry. Now, what do I mean by healing dentistry? When you talk about preventive dentistry, or you talk about something related to just things that people have heard over and over again, their eyes glaze over and they fall asleep. We don't want to talk about it. The idea of healing dentistry is a proactive intervention. The idea of knowing where you are in terms of your diagnosis, your treatment, either caries treatment, perio treatment, or many other things that you saw today in terms of the Ozonics machine. The idea of understanding the mechanism of how the disease process starts, how it continues, and how to intervene. So you're not doing minimal intervention. You're not doing minimal invasive. You're actually doing proactive intervention. I like to use that healing or proactive intervention, whether you're speaking to the more scientific mind or the one that's interested more in the natural progression or the natural healing process. So today we're going to talk about the paradigm shift, this paradigm shift where we've forever, especially in North America, actually in Europe, you're way ahead of us in terms of our ideas, in terms of healing and proactive intervention. Because we have this very major surgical model, mostly because you're paid more the more you destroy, which is unfortunate. I want to go back to the medical model. That's something that is very close to my heart, and I think a lot of you here have grown up with it more than we have in North America. So let's think medical model. I'll be discussing caries. Actually, I have to give a tremendous benefit to, I guess the person who got me really excited and energized about Ozone is Dr. Lynch, who's here in the audience and who gave an incredibly good presentation this afternoon. He turned me on to the idea of healing dentistry. This was 7 years ago, 2003 in Barcelona. And the idea of being able to heal was incredible. I walked out of there with my head just spinning with excitement. Because healing caries, impossible. We know we have to cut it all out, and then we have to fill. So what are we doing? We're removing the best material on earth that we can fill with and putting in something that's artificial and not exactly the best. So we can do, because we understand the process of caries evolution, we can control and understand proactively with a healing method, all the way from adhesion, colonization, demineralization, white spot lesions, enamel lesions, dentin lesions, and a bit in terms of the pulpal lesions, not necessarily to heal the pulp, but to maybe just do one canal, clean out one canal, and save the other pulpal canal. So these are all things that we're able to do because we understand the process. So all of this can be dealt with in terms of ozone. We were talking about the Ozonics machine. It can be used for caries and endodontics. I won't go through all the details because you've heard a lot of it today. I'm going to mostly deal with caries itself and how to deal with it. So we can do it for caries and endodontics and for desensitization. Now, in terms of preparation, in North America, we do think, we think along conservation. Dentists do want to conserve tooth structure. They really do. But things get in the way. The running of a practice, again, return on investment, things like that do enter into line. But what if we can do both? Have an excellent machine where we can do a healing process as well as create a nice income for ourselves. So dentist's goal is to conserve tooth structure. But in reality, we always find a faster, more efficient way of amputating tooth structure. We want to be more destructive, but unfortunately we always find ways of being more invasive. We want to arrest decay, but what we do instead is just remove healthy structure to make it convenient. You saw Dr. Lynch's presentation this afternoon where he's talking about maintaining the marginal ridge. You will never, ever create a marginal ridge as beautiful as the one that you were born with, or not born with, but what was created by Mother Nature that came into your mouth, which was there before it was destroyed. And it wasn't actually destroyed. It's interproximal decay that's causing you to remove that tooth structure. We don't have to. So we're now looking at healing tooth structure. Hard tissue, soft tissue. So what are our dental objectives? The dentist wants conservative dentistry. He or she wants to arrest decay, wants long-term elimination of decay, and patient comfort. What does the patient want? The patient wants, obviously, the first thing is no pain. No injections, comfortable routine treatment, and that's why this paradigm shift benefits both the dentist and the patient. The old thinking is, okay, I have a problem, I'm going to drill it. Then I'll drill it some more. I start off with a very small lesion in a patient of, let's say, 10 or 11 years of age. By the time they get to be 25, then it has to be replaced. By the time they're 35, they now have something interproximally, it's deeper, maybe an endo, a little bit later an implant, and then we hear with periimplantitis, it's gone because of that issue. So long-term, it doesn't, we're drilling more, we're filling it, we're hoping and praying, but long-term we know this tooth is going to fail. This 11-year-old patient will someday be 80 without that tooth because we've been doing all this for a long period of time. The new paradigm shift is, let's gain access, let's ozonate it, and it will remineralize. So you can fill with confidence. You've eliminated the etiological agent, you've eliminated the bacteria, you can fill with confidence, and you know the body is in some way healing itself. Because if we leave some things to heal, they will heal because we're given a lot of mechanisms in our own physiology. So I know we've done a little bit of this. I'll go through this quickly. We know that ozone gas is naturally formed in the atmosphere. And the important thing is that it decomposes to a natural substance, which is a safe material essential for all life. It's been used to purify drinking water since 1893. We know that we have to commend Nikola Tesla, who developed the ozone generators in 1896. And it's been used to purify water in France since 1906. We're lucky in Canada it also is used to purify water, and a lot of other countries as well, in Germany and Switzerland. The benefits are that it filters out the harmful UV radiation from the sun, we know that. Effective as a bactericidal, viral, and fungal deactivator. And ozone is so much more effective than the chemical way of doing it that we've been doing for such a long time, like chlorine. Chlorine has a lot of toxic properties. Ozone does not. It works, so ozone kills bacteria over 3 times faster than chlorine-based products without that toxicity. It destroys viruses and fungi instantaneously, and it sterilizes by oxidation or direct kill attack of biomaterials. And as the WHO has put forth, there's no side effects to ozone if the amount is 0.05 parts per million over 8 hours. And none of these machines create more than that toxic dose. It's nature's own purifier. So if we're looking for healing mechanisms that are created in nature, this is the ideal healing mechanism. It's been used therapeutically in medicine for over a century, and in dentistry as well. Not as long, for over 10 years at least, but these things have been around for over 100 years. In medicine, we have ozonated transfusion, blood for transfusions. All the organisms in stored blood supplies are inactivated. In First World War, the open wounds were healed by ozone. We know my mother's diabetic, and I've been dealing with ozone with different wound issues in diabetics and in a lot of other medically compromised people, especially as they age. Bed sores. You need to find ways of healing them. They can be easily healed with ozone. and there are many other applications.